Chapter 33, Pharmacology and Preparation of Drug Administration. Pharmacology is the study of drugs and their effects on living organisms. So, a drug is a substance that changes the functions of a living organism in some way. So, every year, new drugs are being made. Some drugs are better versions of one drug, other drugs might just be a cheaper version of a drug. There's a whole process companies must go through to test drugs and then get approved to use the drug. The regulatory process for approval to sell a medication includes several stages of testing on animals and humans. So, physicians, nurses, and pharmacists are responsible for the safe and therapeutic effects of drugs. So, if a physician orders something that's not safe for a patient and the nurse administers it, the nurse can be held liable for that drug. So if the physician orders something and you're unsure about it, you need to call and ask for clarification. Um, you ordered this drug and this is not the usual dose for this or the usual medication to treat this. Are you sure this is what you wanted? Just to get clarification. Now, if the physician provides you a response that you're satisfied with, then it's okay to go ahead and administer the medication or treatment or whatnot. However, if the physician provides you a response that you're still not sure, then you have the right to refuse to administer that medication or treatment. Um, so you have to, be able to document that and then take that to your supervisor and let your supervisor know why you're refusing to administer that medication or drug. So you can't just refuse just because you feel like refusing. You have to have a legitimate reason that you document and then that document that you've talked to the physician and you're still not okay with administering that medication. So you are held liable for administering that medication. If something should happen to that patient, you can't use the excuse, well, the physician ordered it, and so I just administered it. There was a case with a major hospital in Ohio where 9 nurses ended up losing their license because the physician ordered a lethal dose of fentanyl. And not one of the 9 nurses questioned the physician on it ordering that medication. It was, I believe, 10 times the legal dose for that medication. And several patients ended up dying as a result. And so all those nurses lost their license, um, as well as their physician received some type of punitive sanctions or whatnot. But you are still held liable. You can't use the excuse that the physician ordered it. So, as we stated, thousands of new drugs are created every year. So, you will not know every drug, but you need to be able to look them up and safely calculate drug dosages. So, as nurses, you need to be knowledgeable of possible drug interactions, side effects, nursing implications. So, for example, do you need to get a blood pressure? Do you need to get a heart rate? Do you need to get a lab value before giving a med or whatever? You need to be able to understand drug calculations, and you need to be able to use the 6 rights of patient um, medication administration. So, taking it a step further, like I said, as the nurse, you are responsible and held liable for administering medications and can't fall back on what the physician ordered it so that now, granted, you can't administer something without a physician order, but at the same time, you still need to be aware of if this is an appropriate medication that you are administering. And so you are still held liable if you administer something that was inappropriate. So you need to know, you need to be knowledgeable of the appropriate dosage for the patient. So calculating your drug calculations appropriately. You need to know generic and trade names of medications, the desired effect of the drug, possible adverse reactions, what are your expected side effects of that drug, what are your drug-to-drug interactions. So the person's taking this and this medication and knowing that that could possibly be an interaction between the two, drug and food interactions, and preparation um, of the drug for administration. So you want to make sure you read the label 3 times um, before taking it to the shelf, before measuring and comparing it to the order, and then again returning it to the shelf. You want to uh, read that label 3 times. So drugs have 3 names typically: their chemical name, their generic name, and then their trade name. So typically nurses don't use the chemical name. However, you should know the generic name and the trade name of various drugs. The trade name is protected by a trademark, and the generic name is not protected by a trademark. For example, your book uses the example of ibuprofen. It's marketed under the trade names of Advil and Motrin. So generic drugs by law should be identical in content to the trade name, but they're just less expensive. In your book on page 636, table 33.1, there is a table there that has examples of drug categories by generic name endings. So you can learn the endings of words and know what they mean. So for example, drugs ending in prils, Prils. For example, the Cinepril, you know that those are ACE inhibitors, which are antihypertensives. Um, so you can, kind of you'll start to learn more of that when you get to pharmacology and how to understand drugs um, and their by their endings. All right, drugs can be classified by their effects, such as anticonvulsants, which are your anti-seizure medications, by the symptoms they relieve, such as antihypertensive, so they relieve blood pressure, or by their desired effects, such as analgesic. Analgesic is a pain reliever. So you need to make sure you start to understand these different words. Like I said, analgesic is a pain reliever. And so some drugs, such as aspirin, belong to more than one of these categories. So for, like I said, aspirin is has several different things that it does. Aspirin is categorized as an antipyretic, which is a fever reducer. It's also classified as an anti-inflammatory, um, and analgesic. What did we say? Analgesic was relief pain, and it has some anti-clotting properties. So sometimes maybe people might be taking aspirin on a regular basis for arthritis, but you also need to know that aspirin has some anti-clotting properties. So just because they're taking it for um, arthritis, you still need to monitor for bleeding and bruising easy because it does have those anti-clotting properties. So you need to understand all the effects that that drug may have. In your book on pages 637 and 638, there's a table 33.2 um, with selected groups of drugs classified by their action. So let's take, for instance, let's look at anticoagulants. And so anticoagulants, we know, inhibit clotting of the blood. So that's like your warfarin and your heparin. And so you need to know that one of the things that they might be able to bleed and bruise easy, right? So another thing, narcotics or opioids. What are those things for? Relief moderate to severe pain. So those things would be like your morphine, your codeine, meperidine, or things like that, fentanyl, oxycodone. Those would be considered narcotics. So you can take a look at that chart there and start to learn drug classifications by the action that they provide. So there are a few different individuals that can actually prescribe medications. So obviously your physicians can prescribe medications, dentists, osteopaths. Osteopaths is that's a physician that focuses on joint, muscles, spine, stuff like that. Veterinarians can prescribe medication. Um, Podiatrists can prescribe medications. And then also under the authority of a physician's assistant can prescribe, a nurse practitioner can prescribe, or an advanced practice nurse. All these individuals can prescribe um, medications as well. But like I said, these at the bottom, they have to be under the authority of a physician. So the manufacture and sale of drugs are regulated by the Food and Drug Act of 1906, um, the Federal Food, Drug, and Cosmetic Act of 1938, and then the Comprehensive Drug Abuse Prevention and Control Act of 1970. Now, one thing I want you to also make sure you keep in mind in a hospital, the responsibility for the security of controlled drugs being like your narcotics, things like that. Those the security is shared by the pharmacists and the nurses. So you'll have some responsibility in helping ensure the security of those controlled substances or controlled drugs. So, the Controlled Substance Act of 1970 classifies drugs according to their abuse potential, and the Drug Enforcement Agency, or DEA, is the enforcing agency. So, we have Schedule 1, 2, 3, 4, and 5. So, our Schedule 1 drugs, um, those drugs have a high potential for dependence or a high potential for abuse. And so it's not approved for they're not approved for medical use. Um, the vault or safe storage is required. Separate record keeping is required also for these. So they're high potential for dependency or abuse with no medical use. So things that might fall into this category might be heroin, LSD, ecstasy, things like that. Your Schedule 2, they have a high potential for dependency or abuse, and so they also have some medical benefit to them, and so there's a written prescription required. No refills allowed on these type medications. So things that might fall into this category would be morphine, um, dilaudid, Demerol, oxycodone, um, things like that. And then your Schedule 3 drugs, um, there's a little less or a little lower potential for abuse with these drugs, and they do have some medical uh, benefit. There's a small or low risk for dependency with these drugs, but they do have some medical um, benefits. So you have to have secure storage area. It doesn't require a vault or safe or anything like that, but it does require a written or oral prescription, and refills are allowed on this one. So things that might fall into this category: acetaminophen with codeine, um, steroids, depressants, things like that. Now, also, I didn't mention there is a chart in your book on page 639. That is table 33.3 that goes over each of these schedules as well. And so then your Schedule 4 drugs, they have a medical uh, medical use, there's low potential for um, abuse or dependency with these drugs. So things like that would include in that would be like your Valium or your Xanax or something like that. Um, and then Schedule 5 is very low potential for dependency or abuse, and they definitely have some medical benefits to them. So that would be your Robitussin AC or your Finnegan with codeine or something like that. So the only one that does not have medical benefits are your Schedule 1. So the higher the Schedule 1 is the highest potential for abuse and dependency. And as you go up, the dependency level decreases, but the others have some type of medical benefit to them. So drugs can be used for pleasure, recreational, or as a treatment. And so a drug that is used for a therapeutic purpose is called a medication. And so medications can be used for a variety of reasons. They can be used for treatment purposes, palliation. Palliation just means uh, provide comfort and free of pain. They can also be used to diagnose. They can be used to cure. They can be used to prevent diseases. So they can be used for a variety of different reasons, and drugs can be dispensed and administered by pharmacists as well as those people that are prescribing the drugs. And as we stated, they have a chemical name, a generic name, and a trade name. Drugs, they can come in many forms, such as tablets, capsules, ointments, solutions, suspensions, and suppositories as well. So pharmacokinetics, that's how drugs enter the body, how they're metabolized, and how they reach the site of action, and then how they're excreted from the body. So the drug is distributed to the tissues and the site of action, but certain physical characteristics, such as a person's weight, can impact how the drug reacts. For example, the drug may be more concentrated in a person weighing less because they don't have as much body fat to absorb the drug. So other things that factors that can impact how the drug is absorbed. We said the person's weight, their body weight, their age. So older individuals may not absorb drugs as well, and they may be more concentrated because number one, they don't have as much body weight. They have less fluid as well. Also, disease conditions. Do they have certain diseases that are preventing them from absorbing uh, the drug appropriately? Do they have kidney issues? Do they have liver issues or whatnot? Sex. Sex can be a determination. Genetic factors can be a determination. Immune mechanisms, hot and cold weather, all these things can impact whether how a drug is distributed in or absorbed in the body, I should say. In your book on page 640, there's table 33.5 that shows the differences in absorption by route. So how you administer the drug can determine how quickly or uh, slowly a drug is absorbed. So you can administer a drug transdermal via skin, the mucous membrane, the respiratory tract, oral, IM intramuscular, subcutaneous, intravenous. So let's look at that. So if I was to administer a drug via skin transdermally, that would be a slow absorption. So I know that's going to be pretty slow. Mucous membranes, that's going to be pretty quick absorption. Respiratory tract, that's going to be quick absorption as well. So maybe I had an inhaler or something like that. Oral, that would be my pills, things I give orally or whatever. It could be a liquid orally. That's going to be a slow absorption, things that I administer orally. I am intramuscular, so that depends on the form of the drug. Um, so if it's thicker or not. So if it's a thicker drug that I'm administering IM, the absorption may be a little bit slower. Subcutaneous, that's the fatty tissue. So subcutaneous fatty tissue like the abdomen or the fatty parts of the arm or the fatty parts of the thigh, that's going to be a slow absorption. And my most rapid absorption is going to be intravenously. That's going to be the route that's going to have the quickest absorption. So if I need something to get into the system quickly, then I'm going to administer intravenously or IV. Pharmacodynamics explores a drug's actions and its effect on the body. The drug action includes changes that are occurring at the cellular level. So, what is going on in the body that you cannot see, right? The drug effect is the response you are able to see as a result of the drug action. So, for example, if you administer an antihypertensive, you may not see um, the drug action at the cellular level where it binds to a particular site, preventing another chemical from binding to that site. Whereas the drug effect that's produced, you should see is the person's blood pressure being lowered. So when we look at different drugs, each of our drugs should have an onset, peak, and duration. The onset is when the drug reaches a minimum effect of concentration. So when it starts to take effect in the body. The peak occurs when the highest blood or plasma concentration of the drug is achieved. So when the drug is at its highest level of concentration in the body. And the duration is the length of time the drug exerts its pharmacologic effect. So how long does it stay in the body? So you have drugs that are antagonists, the antagonists or agonists. Drugs that are agonists are drugs that produce a response. They produce a response. So, for example, oxycodone or morphine. Antagonists are drugs that block a response. So, example, that would be like your naloxone uh, or your antihypertensives or things like that. Those would be considered antagonists. So our drugs can have four types of actions: stimulation or depression, replacement, inhibition, or killing organisms, or irritation. So when we talk about either drugs can stimulate you or cause depress something, right? Um, and so you know it's going to either increase something or decrease something. Replacement, those replace something you are low in. Maybe you're taking insulin to replace because you don't have insulin. Maybe you're taking vitamin D because you don't have vitamin D or something like that. So that's a replacement. And then inhibition or killing organisms, that could be like your antibiotics or your antivirals or things like that. And irritation. Irritation is like a laxative or something to irritate the colon to produce defecation. All right, some drugs need to be taken on an empty stomach, and others need to be taken with food because for several different reasons. They might speed up, reduce, or prevent the absorption of a drug in the bloodstream. It might delay emptying of the stomach, and so that would delay the onset of the therapeutic effect of the drug. Some drugs, the acidic gastric juices might affect the rate in which the pill is broken down. And so, as the nurse, you need to know this. Should this medication be taken on an empty stomach or should it be taken with food? Also, as the nurse, you need to know if the drug is incompatible with other drugs. Um, is it going to interact with the drug? Is it called, going to cause a negative effect? A lot of your the new technology that they have out now is designed to help you quickly identify these things. But if you don't know this, then you need to make sure you're looking your drugs up um, ahead of time so you'll know, okay, they're taking this that could interact with that particular drug. So as a nurse, you need to know this. All right, on page 643, table 33.6, there's various routes of drug administration. So we can administer drugs through various routes. If you see the word or the letters PO, that means that the drug is administered by mouth. And so they'll swallow it. So it could be a pill, it could be a liquid or whatever, but it's administered by mouth. SL means sublingually. So sublingually means the drug is placed under the tongue and it'll dissolve under the tongue and not swallow. Buccal means it's placed against the mucous membrane of the cheek. So it's in the mouth, but up against the cheek where it's dissolved. And so it's not chewed or swallowed. Then you have intradermal, which is in the dermis of the skin, right? Subcutaneous is into the fatty tissues. IM, which is intramuscular, which is injected into the muscle. IV, which is intravenously, which is injected to the vein. Epidural, that's injected into the epidural space of the spinal column. Intrathecal, that's injected into the intrathecal space of the spinal column. Topical, so topical on the skin or something like that, the ear, the eye. Transdermal is a small area of the skin. Drugs can be administered vaginally, rectally, or via inhalation as well, are various routes that drugs can be administered. All right, it's the nurse's responsibility to determine if the drug, the dose, and the timing are appropriate for the patient, and you need to speak up. So you need to analyze the physician's order and determine if the drug, the dose, the timing of the drug are appropriate. Be aware of what usual doses are for the adult or the child or whatever. You're responsible for monitoring any lab values or vital signs or whatever needs to be monitored based on a drug that they're taking. Um, so that means if, like we said, you can't just say, oh, the physician ordered it, so, I administered. That's not going to hold up in a court of law because an error could be life-threatening for a patient. So you need to understand, this is not going back to that situation where those 9 nurses administered that lethal dose of fentanyl. They should have spoken up and said, hey, this is an excessive amount of fentanyl that we're administering to these patients. Is this appropriate? And went to that physician and said that if the physician didn't provide an appropriate response, then it was the nurse had the right to refuse to administer that medication, document it, and then notify your supervisor about that medication. But you have to speak up for your patient if you see something that's not appropriate for your patient. Also, the Joint Commission has published a list of abbreviations that should not be used in documenting because they've caused so much confusion and errors in medication administration. So in your book on page 644, table 33.7, there's a list of those um, do not use abbreviations. I'm not going to go through all of them, but let me just point out a few of them. So we, previously may have used U for unit. You should be writing out the word unit because it's been mistaken for things like 0 or 4 or CC or something like that. We used to use QD for daily or every day or QOD for every other day. We shouldn't be using that. We should say daily or every day, or we should say every other day because they have been mistaken for things like that as well. A trailing 0. So, the decimal point could have been missed. So make sure you go 0.2 or whatever it might be, right? You shouldn't be using MS for morphine or MgSO4 for magnesium sulfate. You should write out the words. and things like that. So you can kind of go down the list there and see what are some of the abbreviations that we should no longer be using in our documentation, and we should write out the words completely so there's no confusion or misinterpretation of what we're saying. Okay, so we are going to go over how to calculate dosages, pediatric safe dosages for children. But your pediatric safe dosages will be based on age, size, and weight of that child. So it's not given based on a standardized amount that every 3-year-old would get 2 milligrams or whatever of this drug. It's based on their age, their weight, and size or whatnot. So we will cover that in detail in fundamentals as to how to calculate those dosages. Never tell a child that the medication is candy because then, they could mistakenly get into it and say, oh, this was candy. And, I want, no. So we're never going to tell children that medication is candy. And always include the parents in care planning for your children or whatnot, and ask them what is the least effective or the most effective and least traumatic way that the child likes to take their medications. So considerations for our older adults, and um, when we're looking at administering medications for our older adults, as I previously stated, older adults may not be able to take as much medication as someone else because it may be more concentrated in their system for a variety of reasons. They lose weight or lose body mass as they get older. They also tend to lose fluid. Maybe they have some chronic medical conditions um, that prevent them from absorbing medications as quickly. Their metabolism is going to be slowed down as well. If they're taking anti-inflammatories for arthritis, that can impact how medications are absorbed. Maybe they have, difficulty swallowing. Also, uh, take into considerations, do they need a pill organizer to help them remember to take their pills? Do they have family members that are helping them to um, take their medication? So you want to take all these things into consideration when we are um, educating our patients on medication administration and whatnot as well. So these just might be some considerations for a patient and home care. So can they afford the medication? A lot of times, especially with our older adults, they're making a decision: do I buy medication? Do I buy food? Do I buy medication? Do I pay rent? And so a lot of times they may be taking the medications at half doses so that it will last longer, or every other day or whatever, so it'll last longer or whatever. So take that into consideration. Maybe you need to talk to the physician about getting a generic form of that medication or a cheaper medication that would do the same thing. Do they need a pill organizer? You want to keep that in mind as well. Um, can the patient open the pill bottle? Do they have arthritis and that prevents them from opening that pill bottle? Maybe you can look into ordering, they have packets, medication packets that would be easy access or easy open. They even have pill bottles that are easy open that you may be able to assist your patient in getting. Can the patient physically get the refills? Do we need to help them set up um, uh, a mail order if they can't physically get to the store to pick up refills or don't have anyone assist them in that matter? Is the caregiver going to be assisting them? So if so, we need to make sure we're educating the patient and their caregiver on medications, how to administer the medications and whatnot. Do they need a home health nurse to come out and help get things set up and organize and do further education. All right, drug standards that must be met by manufacturers include all of the following except. So the answer here is 3, price. So price is not a standard that must be met by manufacturers. The standards are purity, potency, bioavailability, efficacy, and safety. Okay, question 2. Amanda's patient is 80 years old. All of the following are considerations that must be made when administering medications to the older adult patient except. So the answer here is 4. Older patients older patients should have no difficulties reading labels because they usually wear glasses. So older patients often have limited vision and uh, and they can misread the label on medication containers. So they should be encouraged to have another person verify or color code medications. All the other statements are correct. Okay, question 3. Lola is giving her patient an oral medication. Her patient wants to know how quickly it will take effect. Lola's correct response would be, the answer here is 1. Your medication absorbs slowly, so it will take a while. If you do not begin to feel better in 30 minutes, please let me know. So the rationale for that is the oral medication has a slow absorption rate, and so it will take a while to take effect. Skin and subcutaneous medications are slow as well. And then quick absorption includes the mucous membrane, the respiratory tract, which are your inhalers. And then the quickest, remember, is the IV or intravenous. So answer 4 does not address the patient's concern. Amanda should not be administering the medication if she is not familiar with the pharmacologic um, actions. So there are several reasons a patient may not um, adhere to their medication regimen. Maybe they don't understand what the drug does or why the medication is being taken. So then you need to be able to educate them on that, the importance of taking this medication and what the effects of not taking the medication or taking it properly. Maybe they can't tolerate the side effects of the drug. Maybe it makes them sick or something like that. Um, Maybe they don't have the ability to afford the medication as we discussed before. And so then is there a generic version of that drug we might be able to get ordered, or like I said, another med that will do the same thing. And so, and then another reason, sometimes people don't like to have to depend on some type of drug to help them maintain health or get well or anything like that. So if a patient is refusing to take a medication, yes, you're going to document, but you need to investigate further as to what what is their reason. Why are they refusing um, that medication? Because, like I said, we may need to go to the physician to talk to them about prescribing something different, something that's more affordable, something that doesn't make them more sick or whatnot, or if it's just simply they need to be educated on the importance of it. So make sure if they're refusing, you're going to document they refuse, but you want to dig a little deeper and find out why they're refusing the medication as well. All right, so before we're given any medications, we want to know why we're given that medication. What is it treating? What are our desired effects for administering that medication? What are what's our drug action and any contraindications? What are our side effects that we should be expecting? Um, Do we need to check a lab value before we administer? Do we need to check vital signs? Does this drug affect our vital signs? You don't want to give drugs that you're not familiar with. If you're not familiar with the drug, you always want to have your drug book handy and look those drugs up prior to administering that medication so you can identify all these possible uh, effects or things that could possibly happen, side effects, nursing implications, uh, and things like that. So, although safe medication administration is a shared responsibility between the person that's ordering the medication, the pharmacist, and the person administering the medication, the person who actually administered the medication, being a nurse, can ultimately prevent an unsafe and possibly deadly situation from occurring. So, the administration step represents the last chance to ensure that the right person receives the right medication in the right amount by the right route and the time. So, we need to always make sure we're using our 6 rights of medication administration. So, right drug, right dose, right route, right time, right patient, and right documentation. And you could even add 2 more to that, having the right reason and right response, because we should always be checking back that we are that our patient had the right response that we were looking for from that medication. So how do we check that we have the right drug? Well, we're going to read the label 3 times, right? And then you're going to check the appearance and the order of the drug. How do you ensure you have the right dose? So we need to know our drug calculations, right, for our children. So you want to consider the age of the patient, check the label, and make sure you measure accurately. The right route. So you need to know the methods for giving drugs orally, IM, IV, rectally, so on and so forth. So do we have the right route that has been ordered? So we always got to check our orders. That's the first thing we always have to do, is make sure we're checking our orders. We want to make sure we have the right time. So you have to know the hospital routine for intervals. So some hospitals or some facilities, you might have an hour before and an hour after the medication is due. So for example, if the medication is due at 9 a.m., you may have between 8 and 10 a.m. to administer those medications. Even within the same facility, you could have certain limits, such as uh, a certain unit might require 15 minutes before or 15 minutes after um, that the medication is due that it be administered. So make sure you ensure your you know your facilities intervals as far as having the right time. Um, right patient. You want to check the patient's name on the chart, the medication record, the med card, um, the bed, the wrist tag, whatever. Ask the person. You always want to use 2 identifiers when administering medications. Ask their name and date of birth. Check it against the MAR, and check their wristband. You don't want to assume because a person is in room 203 that that's the patient. If you had a dementia patient and they wandered into room 203, then you could have given the wrong medication to the wrong patient. So ensure you do your 2 identifiers always um, when checking that medication. And then your documentation, you never want to document that you administered a medication prior to administering that medication. So you always want to document immediately after administering the medication to ensure you properly gave the medication first of all, and that they didn't refuse it. So these are just some principles of medication administration. The medication is only given by the person that prepares them. So if another nurse prepares that medication, you never want to administer something else given prepared by another medication. Yes, they should have the knowledge and education to prepare that medication, but you don't know what they put in that pill cup, and you will be held liable for giving something. And so if you didn't prepare it, you don't give it. Medication should not be left at the bedside. I've seen that time and time again where nurses will just leave the medications at the bedside, and anybody could accidentally come in and pick those meds up and take them or whatnot. Or what if your patient forgets to actually take the meds and you've documented that they've taken them and they never did take them? So don't leave the meds at the bedside. Narcotics and controlled substances must be kept under lock and key. Remember, I said the pharmacist and the nurse are responsible for ensuring the security of all um, controlled substances. Orders must be checked before the drugs are given. Always check your orders prior to administering those medications. Um, Avoid distractions when you're preparing medications. If you're in the process of preparing a medication and someone comes up to you, wants to talk, you say, just give me a minute, and you don't want to get distracted so that you don't make any mistakes. And like I said, the nurse must know the drugs that you're giving, what their action are, what the appropriate dosages are, any precautions, any nursing implications. Do you need to check a vital sign? Do you need to check a lab value or anything like that? So, um, always keep these things in mind when administering medications.